In this lecture, we're going to explore some of the more prominent grief and loss theories. I know this sounds boring by topic, but I promise you it's actually pretty interesting and really helps us feel a lot more grounded and have a better foundation in the work that we do with our patients and families. So I do encourage you to pay attention and to be open to some of these different ideas. Prior to the late 1940s and 50s, very little research had been conducted on death and dying. Since that time, we've been blessed with many amazing researchers, physicians, psychiatrists, and teachers who have jumped right in and provided us with some of our current best practices when it comes to theoretical grief knowledge and understanding. This all began with Elisabeth Kubler-Ross, a Swiss-born psychiatrist, a pioneer in near-death studies, and author of the groundbreaking book On Death and Dying in 1969. She focused her life's work to understanding the grieving process that someone experiences as they face their own impending death. In other words, if someone found out or knew they were going to die, what did they go through? What process did they experience? What she came up with was a 5-stage process we see here on the screen: denial, anger, bargaining, depression, and acceptance. I'm sure you've heard this before. If you were to find out today that you had just a few months to live, would you immediately believe it, or would you experience some shock and want to first deny it? Would you want a second or third opinion to confirm the diagnosis? In this day and age, that's what most people do. No one wants to face the fact that they're dying, especially if they're younger or they still feel as though they have much to contribute to the world. That denial period doesn't usually last long, though, and the truth sinks in. People may become angry and have thoughts or reactions like, "This isn't fair," or they might be angry with others, including God, their doctors, or family members, even themselves. At some point, they realize that there's nothing they can really do about it, and they begin to bargain. This is where we hear people saying things like, "I prayed to God and promised if He saved me, I'd never do fill in the blank again." Or, "If I can just have one more year, I'll be sure to do this or to not do that." Depression is also common in the death experience because the person has to face the fact that he or she will not live as long as they had hoped. Hopefully, eventually, the person comes to terms with what is going to happen and can use whatever remaining time they have to do things they enjoy and spend time with people they love. Certainly, though, we realize not everyone gets to that point. It's also important to know that these 5 steps do not have to go in order. As humans, and especially as Americans, we like things to be logical and linear. But life and death and grief aren't like that. There's no set process we have to experience. These are just the most common reactions that terminally ill patients face. They can occur in any order, at any time, on any given day. In fact, it's not uncommon to feel all 5 of these things within a short period of time. So any previous misconceptions you had about the grieving process or the dying process, throw them away. Wash the slate clean and start with a more accurate understanding that these are just common emotions for those who are dying. They are not necessarily the same as feelings experienced by other people grieving the death of someone they love. That's even less orderly and less routine. See, this is what I mean. We want grief to be clean and easy and have a finite time limit, but it doesn't. In all actuality, it's more like the circular, messy, all over the place graphic we see on the right. But that's how life is. And it's how death is too. One of the prominent theorists who shed valuable insight on grief was John Bowlby. A psychiatrist, Bowlby developed the attachment theory that most of you are probably familiar with today. His work extends into grief as it relates to our attachments and relationships, so we can see that this is a very real human experience. We grieve anytime we are separated from something we are strongly connected to, and thus it would make sense that it's innate for humans to grieve the death of someone they loved or otherwise had a relationship with. Bowlby suggests that people grieve in sequence, with the basic order listed here: shock and numbness, followed by physical symptoms, feelings, and eventually coping. So he wasn't as detailed in saying exactly what that had to be, but rather he was outlining a more universal, human, and broad process for grieving a loss. Here's a model I came across in all the grief work I've done. To be honest, I can't recall exactly where I saw it or who I adapted it from, but it seemed like a nice balance of order and yet variation. This model suggests that there are a variety of feelings one can experience, based upon whether they just learned about the death, if they're actively working through their grief, or if they're at a point where they can reorganize their life and create new meaning. Take a look at it and see if you can relate to what's shown here. You may even think of other feelings or emotions to add. This is just a nice starting point. Strobe and Schutt developed the dual process model, in which they basically acknowledge that two important tasks are taking place. That you have to express your feelings after a loss, but also control them at the same time. They suggest that grief involves alternating between thinking about what you've lost and trying to avoid thinking about it so you don't become overwhelmed. I think of it like walking on a tightrope. You think about the fact that you're walking up high, but you don't let it overtake you or you'll fall and risk injury. They're also saying that both primary losses and secondary losses are important. Remember, the main loss is the primary one, and all the other losses that happen like a domino effect after it are those secondary losses. And you have to consider this as you try to rebalance or readjust your life. As with other theorists, Strobe and Schutt acknowledge that how you do this will depend on the death, on your gender, your personality, and your cultural background. Dr. J. William Worden's work helped develop one of the most frequently used models of grief, the 4 tasks of grieving. Bill's a great guy. I've met him a couple times when I've attended and presented at the annual symposium for the National Alliance of Grieving Children. He's been working in the field for several decades and has a real knack for taking things that seem complex and making them not only easy to understand, but also a bit humorous rather than scary or depressing. In Worden's theory, he outlines the following 4 tasks you see on the slide. The first task is that at some point you have to accept the reality of the loss. That person is going to die, or maybe the person already died. They're not coming back. Next, you need to allow yourself or give yourself permission to experience the pain that grief brings. Let yourself be sad, angry, jealous, lonely, and so forth. If you don't allow yourself to feel it, it's not like it's going to go away. It will continue to stay with you. Eventually, and this is different for everyone, but eventually you'll be able to adjust to a new normal or a life and environment in which the deceased person is no longer there. In other words, you start to move forward. You go on with life even though that person has died. It doesn't mean you don't miss them or think about them every day, but you're not stuck in your grief, and you're able to continue living and doing what you need to do. Ultimately, the hope is that you'll be able to emotionally invest in new relationships, endeavors, hobbies, and experiences. You're not forgetting about the person. You're not replacing the person. But you're able to continue meeting new people and investing part of yourself in the world around you. I like this model because to me it makes sense, and it's also pretty short and to the point, while allowing for varied interpretation and experiences. We'll also talk soon about how this affects children and teens differently than adults, especially when it's harder for young ones to understand that death is permanent. Alan Wolfelt is another very popular grief guru in current times. He's a great guy, really charismatic and down to earth. I've met him several times, and I think people like him because he makes grief very approachable, not like something you have to avoid or be scared of. Instead, his approach uses a lot of introspection and nature and calmness. In fact, he lives at a retreat center he built in Fort Collins, Colorado, called the Center for Loss and Life Transition, where he hosts seminars and trainings all year round. What I'd like to focus on for Wolfelt is his work on companioning versus treating. I've posted a one-page copy of his model in Doc Sharing. If you haven't printed it out yet, please push pause and do so right now. If you've already printed it, then go ahead and pull it out. I'm not going to read the whole thing word for word, as you're certainly able to do that. So I'd like you to push pause, read through that short one-page piece right now, and then push play to continue. Okay, now that you've read it, let's go over a few other important highlights of Wolfelt's work. Wolfelt cautions us about automatically applying the medical model to bereavement care. We've talked before about how there's this desire to assess, diagnose, and treat grief like an illness that needs fixed or cured. Don't do that. Far too often, we not only pathologize grief, but we fail to consider aspects of culture and personality that play an important role. Our medical model also lacks attention to the spiritual side of life and death, and in many cases, it's cold and lacks empathy. Instead, Wolfelt says, quietness and emptiness invite the heart to observe signs of sacredness, to regain purpose, to rediscover love, and to renew life. Wolfelt also cautions us from using this managed care approach to grieving when it's really a soul-based journey. In other words, grief does not need fixed, and it certainly cannot be resolved in a specific number of doctor's visits, prescription medications, or therapy sessions. You cannot quantify and dictate what is such a truly subjective, individualized, and unique experience. Rather, we should not try to act like the experts. Instead, we should companion the grieving. But what does companioning mean? Let's look at that one-page handout again, and I want to read a few lines aloud. Companioning is about honoring the spirit. It is not about focusing on the intellect. Companioning is about curiosity. It is not about expertise. Companioning is about learning from others. It is not about teaching them. Companioning is about walking alongside. It is not about leading. Companioning is about being still. It is not about frantic movement forward. Companioning is about discovering the gifts of sacred silence. It is not about filling every painful moment with words. Companioning is about listening with the heart. It is not about analyzing with the head. Companioning is about bearing witness to the struggles of others. It is not about directing those struggles. Companioning is about being present to another person's pain. It is not about taking away that pain. Companioning is about respecting disorder and confusion. It is not about imposing order and logic. Finally, companioning is about going to the wilderness of the soul with another human being. It is not about thinking you are responsible for finding the way out. So what do you think? Pretty powerful, right? But also pretty liberating and empowering. It takes the pressure off of us trying to fix everyone and rather allows us to do many other important, meaningful things for our patients at the end of their lives. Thus, Wolfelt takes a similar encouraging stance on grieving. It involves growing, changing, and adapting to this new normal. Things will not ever be exactly like they were before, but it doesn't mean it's all bad either. In fact, growth brings many positive opportunities, including change, a willingness to encounter pain, finding a new inner balance with no endpoints, exploring our assumptions about life, and ultimately actualizing our losses. That sounds pretty good to me. Just like Worden and Wolfelt, Doka has done extensive work with grief and loss. His expertise comes in the area of styles of grieving, and we're going to look at two of his most useful and well-known theories here at the end of this lecture. Before we jump into specifics, though, it's important to know that Doka believes grief styles exist along a continuum. No one uses only one set approach to grieving in every single circumstance. Rather, we all fall somewhere along this line in terms of how we process loss and how we grieve. Everyone's grief is unique, and there is no one right or wrong way to do it. Much of this just has to do with who we are as a person, our culture, our personality, our gender, our temperament. Based on who we are, we all lean towards certain types of coping over others. It's just natural. Based on how that was received, we may continue to express grief in the same way, or we may feel a sense of dissonance, or that we can't really show how we feel because our natural preferred way of expression may not be socially approved or accepted. Let's start by looking at intuitive versus instrumental grieving. For those people who employ a more intuitive approach, they may experience strong affection reactions which mirror their inner feelings. Their ability to adjust and adapt to the loss revolves around their ability to express and explore their feelings. For those who are more instrumental in their grief, they experience it more cognitively and behaviorally. In other words, rather than expressing lots of emotions, they're more likely to do a lot of thinking about it or have to do something to work through their grief. At the bottom of this slide, we see a line that represents this spectrum or this continuum. If you were to do a quick self-assessment, where would you fall on that line? Are you a more intuitive griever or a more instrumental griever? Put a dot or X where you think you fall on this continuum. Doka has also done a lot of work on gender differences in grieving. On page 133 of his Living with Grief book, he works with Terry Martin to talk about revisiting masculine grief, and they outline 4 attributes more common to masculine grieving. The focus, they say, is on the following. First, having more self-control, mastering of one's thoughts and feelings, or more rational thinking versus expression of deep feelings. Anger is often more accessible and more easy to control and express. Second, it's more cognitive dealing with grief, turning into thoughts versus affective or emotional cues. Third, immersing oneself into some form of activity. Maybe it's exercise, maybe it's a project where you're doing something or building something. And fourth, masculine grievers are less likely to use support groups or to seek people who want to openly share, but they might find support in those who are comfortable supporting them without having to talk openly about it. So in a support group setting, even if someone's not talking a lot or sharing a lot, it doesn't mean they're not getting anything out of group. They're still benefiting from listening to others. That being said, these aren't set rules or guidelines. We see some examples here of more feminine grief styles and more masculine grief styles, but we should always look for individuality in coping with grief and loss. In fact, over the years, I've met many females who have a more masculine way of grieving, according to this model, and many males who are definitely more feminine in their approach to grieving. It's not a measure of or valuing of how you do it. The point is just to recognize that there are different ways people grieve, and it's helpful for us to understand what works for people. Oftentimes we see this as a great source of stress in marriage or in families because people grieve their own way and others don't always understand that. Then people get in arguments or accuse each other of not grieving as much or not grieving in the right way, when in fact they just have very different natural ways of going about it. So what do you think? Which of these theories or approaches most resonated with you? Why do you think that is? Were there any that seemed too confusing or too complex? In conclusion, if you could ask any one of these specific grief experts a question, what would it be?